I'm going to talk about reasonable accommodations and also applying that to people with psychiatric diagnoses. So there are a ton of different diagnoses, and we say two people with bipolar disorder are going to walk away with the same accommodations. That is not true. So really what this looks like is looking at how does the bipolar disorder affect each of those students in the learning environment, and one could look very different than the other. So really what matters in that determination is the documentation. So, but just to give you kind of a sense of like some differences in, accommodations that might be approved based on diagnosis would be something like looking at PTSD and maybe some preferential seating, maybe distraction limited environment with extended time on tests. A part of that person having PTSD could be extension on assignments depending on the requests, depending on the documentation, and also typically what comes with extended time and assignments is a reasonable time frame because reasonably we can't just extend until the end of the year. We have to extend based on a certain time frame, which can be reasonable. A person with ADHD might also need some particular seating in the classroom. It might be better for that person to sit in the front or in a particular area that helps them concentrate better. Another part of that is the distraction limited testing environment, which we know that maybe a person with ADHD might need that extra focus. A part of that too is maybe recording lectures and, being able to have that person listen back to them is also helpful for retention of information. Thought disorders. So people with thought disorders might need to take a break in the classroom, so we might add that accommodation into play if that person gets easily overwhelmed or distracted or might need to take a medication break. We have seen those things in those requests before that can be reasonable. Um, the other part is that, the accommodations also in the classroom versus an online setting look a little bit different because when you're at home or wherever you are, you can access the course content in a very different way. Now, depending on the institution, always those accommodations will look different, but typically the process is going to be the same. The student will have to request accommodations, have the interactive process, and meet with a disability provider, probably virtually or by phone. Online, it looks like extended time on tests. Online, it can also look like extensions, maybe as needed, again, dependent on the diagnosis, dependent on the functional limitations of that diagnosis. A person with anxiety on utilizing online classes might also need some changes within presentation style. So maybe there's a recorded video that can happen instead of doing a live session presentation. And maybe that could also be applied to the classroom in person. Maybe that person can record themselves talking and send that to the professor versus having to present in front of a class. So there are different things that can be done, and a lot of the job of disability services is being creative.